Thank you, Madam Chair. Thank you to all the officials with us today. As a former medical officer of health in charge of a public health unit serving some 1.2 million people, obviously we were extremely aware of the expensive vaccines that were stored in freezer units, etc. Just to say that not only did we have alarm systems, but of course we had a visual, personal inspection on a daily basis because technology can fail. So going back to the loss of the $20 million worth of product, could you clearly describe what your previous protocols were to ensure the safety of this product? And the changes that you have now made that will hopefully, of course, mean that this will not occur again.
So, as just discussed in the in-camera session, we did do a full and comprehensive root cause analysis. I'm confident that we have addressed the root cause that was identified as a system issue. A contributing factor was our real-time 24/7 monitoring system for our refrigerator and freezer units. We have made enhancements to the oversight and the monitoring of those freezer units. The 24/7 monitoring still does occur. We have staff available to respond to those alarms on 24/7 basis, and we have increased oversight and management at the warehouse in the terms of personnel, as well as our regulatory affairs and quality assurance teams and the teams that manage the equipment and maintenance.
You've heard some suggestions here. Mr. Bailey suggested a locking mechanism. MP Ailofson did also. I think it wasn't so much from a security point of view that those suggestions were made, but perhaps to keep the units airtight without any possibility of a door remaining even a sheet of a paper width opening. Has anyone else ever made a suggestion like that to you?
So thank you for the question, Mr. Chair. I think I should also clarify that these units do have a locking mechanism on them. It's an industrial locking mechanism that ensures that the door stays closed. It's not like a regular refrigerator where there is no control point. And it's a standard type of mechanism that's used on many of these industrial freezers.
Okay, thank you. In terms of, we know the Auditor General is looking at this issue. Did you consult with other jurisdictions, like-minded jurisdictions, as to the various protocols that they have put in place to ensure that vaccines are safe?
Thank you for the question, Madam Chair. In this specific circumstance, no, we did not. We do, however, dialogue regularly with our federal, provincial, and territorial counterparts that manage similar product, that acquire product from our stockpile as well. And we take these opportunities whenever we do have to deploy product to walk through the protocols that we implement. We hear about the protocols that they have in place. That helps us refine our plans for deployment. As you could imagine, there's not only cold chain considerations, there are also regulatory considerations with these. So each one of these interactions does provide us with an opportunity to learn from one another in an open and frank exchange of information.
And perhaps I might add, I'm in my month number 7 as president of the agency. I have met with my counterparts, particularly focused in on my G7 counterparts, and amongst the issues that we have been discussing is around our strategic stockpiles, and I look forward to those continued dialogues. with and deepening those dialogues with our counterparts. For example, we look forward to a new joint action plan with the European CDC shortly, and we are signing a new memorandum of understanding with the United Kingdom where all of these issues are included. So just to say that at a higher level, with those conversations are happening with our strategic stockpiles is a key area of focus.
How much time left, Madam Chair?
You've got 13 seconds left.
I will cede that.
Thank you.